You did a pretty good job. So my name is Gary Holder-Winfield. I represent the 94th District in New Haven, as we said. I'm not an expert on healthcare. I sit on the Human Services Committee where we deal with a lot of issues that come out of the healthcare arena. And I've had the opportunity to listen to some of the horror stories that people have had to deal with. I'm not an expert on healthcare, but I have lived in our communities for my whole life. And I know that we have not done a good job of advocating for ourselves, and some of the people we've elected haven't done a good job of upholding some of our issues in the state legislature and in the national legislature. And so when I got the call about this panel discussion, even though I'm not an expert, I wanted to be here because when I was watching the healthcare debates this summer, I didn't see something very prevalent in those debates. And I didn't see a lot of us speaking, I didn't see a lot of us attending, and that's important because when you're not there, the discussions don't center around issues that are particular to our communities. As your president was saying, in our communities, there need to be more places where we can access healthcare. Now, access has been talked about during the healthcare debate, but not the type of access that we might be talking about. And I think that's extremely important. If we lived in a perfect world, we wouldn't be sitting here this morning. I'd be home in bed listening to the rain with my wife. But we don't live in a perfect world. But we do live in a world where we can do a lot of things that we didn't think we could do. I mean, we put people on the moon. We have a black president. I mean, all these things we don't think that we can do, we've been able to do. And so I think healthcare may be a difficult thing to talk about. It may be a difficult thing to achieve, but I'm pretty sure that we can, if we have the right conversation, come to a point where we have a healthcare bill that really addresses the issues of the people. Because the reality is this, we're talking about whether or not the healthcare bill as it finally comes out, whatever form it comes out, is deficit neutral. To me, I think that's a mistake, to be honest with you. I think it's a mistake to talk about it being deficit neutral because if we don't do anything, we're still going to affect the deficit in a negative way. So I understand we need to be fiscally responsible, but being fiscally responsible also says to me that if we don't do anything, the deficit will increase because of the healthcare we have. So it's not necessarily the case that we should be deficit neutral. Now, if we can, I think that's a great thing. But I think the bigger issue is how do we fix healthcare? How do we look at providing healthcare? Because in this state, it's not a big state. We have 3-some-odd million people. 343,000 people don't have healthcare. That's a lot of people for a $3 million person state. 264,000 of those people are working. So that says to you, it's not just an issue of people who are not working. It's not just an issue of people who have done something wrong or not done something right in their lives, but it's an issue for all of us. And the reality is this, a couple of years ago, I was trying to provide health care for myself and my wife. I was a working person, and my health care was completely covered, but my wife's wasn't. And as the years went on, every year, healthcare got more and more expensive. So I started off with healthcare that I could afford. And when I ended up, thank goodness I have this job I have now across the street there, pretty much. But when I ended up, the ability to pay for healthcare for my family was not something I could do. And I was a working person. That is not the way we discuss healthcare. We talk about healthcare as if people just either work and have healthcare or they don't. But you can have healthcare today and not be able to afford it tomorrow because of the skyrocketing cost. And it's not a matter of 10, 15 years down the road. It's a matter of 1 or 2 years. And so the people that we need to be addressing are not just the people who don't have healthcare, but they're people who have healthcare and don't necessarily see that tomorrow they won't be able to afford that healthcare. Particular to our communities, though, I think that in the introduction we talked about what we can do, how we can talk to our Congress people, our legislators. We need to do more than that. This room is full of people with big networks, people who know people who are in other states. We need to talk to people who are not, because if you live in Connecticut, you're doing all right in terms of the Congress. You're doing okay. All of our Congress people on board. Some of them are actually at the forefront of pushing healthcare reform, although I would say that you have to talk to them about how it's pushed. But you know people in other states who you need to get active. And the face of the healthcare discussion needs to be a little bit more diversified than it has been, because until that happens, our communities are just not being heard. And if anybody, with 24% of the black people in the state living in poverty, with 36.7% of the Latinos in the state living in poverty, we are definitely affected. And if you look at the numbers nationally, they're right around the same place. So we need to change the way that we have been doing what we're doing. And I think town halls like this, and I thank the Zetas for doing this, town halls like this are a great opportunity for us to get the word out. I'm videotaping it so that people can see it. I think it's a great opportunity for us to get the word out, use our social networks to get people involved, and to really begin to do some of the work that we have not done to address some of the issues that have been brought to you. Because until we do that, our communities are going to continue to suffer, and we have plenty of other issues that we need to worry about. So thank you.